Yes, we are.
Yeah, but I mean, not as much as them.
Oh my god, it's true, huh? So don't just.
Always forward, never back. All right, we are ready. Are you guys ready? Who goes timing? Who filming? No.
I'm doing everything.
You're doing everything.
Yeah, you do so much. Pressing buttons.
Hello everyone, I'm your favorite live show host Caitlin and welcome to the Daily Egg. Today I have a few special guests right here, so why don't you guys go ahead and introduce yourselves.
Hello everyone, my name is Aliha Mughal.
My name is Matthew Rodriguez.
And I'm Sophia Thoman. It's nice to meet you all.
These lovely individuals are docents from the Doja Libby Medical Museum. Today they're here to talk about their new exhibits, so why don't you guys tell me what that's all about?
So, we are going to open a new exhibit soon, which is centered all around the Jazz Age, or the Roaring Twenties. We have a variety of components of the exhibit that we're very excited to show the public. In fact, today we can tell you guys what it's really all about.
Wow, I just love the Jazz Age for all the liveliness and extravagance.
Yes, the Roaring Twenties certainly were known for their extravagance. It was a fun-filled time full of parties, new music, and cultural evolution. However, it served as nothing but a guise for the underlying issues such as racism, the upcoming Red Scare, as well as the upcoming economic crash leading to the Great Depression.
It's just like Matt said, the jazz was all just a disguise for the underlying issues of the time, especially one that's still plaguing our world today, disease.
You see, Caitlin, one of our main goals at the museum is to educate the public on disease throughout history. We want to show people that diseases are more than just statistics of death, that there were actual people who suffered from them. We think it will be truly inspirational to those aspiring to work in healthcare.
Well, that's truly inspirational and I wish you guys success on achieving that goal. Could you guys show us some artifacts that you graciously brought with you today?
As a matter of fact, we can. As you can see, the first thing that we have is this beautiful display, which was made by our team Offset. And it really shows the extravagance, the beauty, and the resplendence that was the Jazz Age. Within, we do have a couple of things that these lovely ladies are going to be pulling out very soon. And we have, one of which are these.
What are those?
These are soap notes. They're medical records that shows the subjective, which is what the patient describes feeling, the objective, which is what the doctor actually saw, the assessment, which is the doctor's conclusion and diagnosis, and the plan for the patient's treatment and follow-up care.
These authentic medical records give great insight to the real struggles that many people faced during the time. We have the original documents here, but we have also digitally enhanced them up here for the audience as well as the judge's view and pleasure.
Wow, that's really great, but now that I think about it, I think tetanus was a prevalent disease during the Jazz Age. Do you guys have anything to show for it?
As a matter of fact, we do. That's exactly what this one's about. So tetanus was a disease that was prevalent in the 1920s that plagued a young boy named Walter Smith. When he went to the doctor, he first described his symptoms as having a lot of spasms and soreness in his extremities, so he would often be things like that. The doctor then measured that he had a high blood pressure and a high respiration rate, and based on these symptoms and his knowledge, he concluded that Walter has tetanus. His final plan, or what he was going to do with Walter at that point, was to assign a lot of bed rest and water, because at that point, once a person contracted tetanus, there was really nothing that could be done.
Oh gosh, that's really terrifying. Do you guys have any more?
We have another soap note here from a patient who had radiation poisoning. Her name is Irene Olson. She was a factory worker and she painted dials on clocks and watches. She would often lick the tip of her paintbrush to keep its tip sharp, but what she didn't know was that the radium-based paint was harmful to her. So after a few years, she developed symptoms such as weakness, fatigue, nausea, and vomiting, as well as a condition called radiation jaw, which was characterized by sores in the mouth, bleeding of the gums, and inflammation around the thyroid area. What's interesting about Irene's case, however, is the fact that she was not actually diagnosed with radiation poisoning. You see, the company wanted to cover up the fact that it was their fault that their workers had contracted radiation poisoning, as they failed to inform them that the paint was harmful. So instead, the doctors diagnosed her with syphilis, prescribing her penicillin. However, since in modern day, today we would not treat workers the same way, and instead she might have been prescribed something such as potassium iodine to help reduce radiation, and ibuprofen to help reduce the pain and swelling that she experienced.
Gosh, that's so scandalous. I can't believe they'd actually do that. It's a good thing that nowadays we have regulations to make sure that never happens again.
Yes, the Jazz Age was definitely a very conflicting time because despite all the glitz and glamour, there was trickery just like this in big business. Radiation poisoning spread like a wildfire among workers due to no assistance from the government and really poor working conditions. They would form unions and protest and advocate for better working conditions and better safety on the job.
Wow, that's really great. It's nice to see how far we've come in terms of occupational hazards. Nowadays, the only thing I have to worry about is spilling coffee all over my new dress. And with that, I think it's time for a commercial break, so we'll be right back.
Introducing the Iron Lung! If you have polio, you probably know how exactly hard it is to breathe. Well, have no fear, the Iron Lung is here. You'll be breathing normally in no time. Just sit back and relax as the Iron Lung returns your breathing to normal. Purchase it today for only $1,500.
And welcome back, folks. If you're just tuning in, these lovely individuals are dozing from the Medical Museum, and they were telling me about their new exhibit revolving around the Jazz Age. You guys have any more artifacts you'd like to show for us?
As a matter of fact, we do. Right here, we have these journals, which were handwritten by people in the Jazz Age. This one in particular is from a woman named Margaret Smith, who happens to be Walter's mother. The following, we have a dramatization of her journal, and we hope that you enjoy.
Mom, I'm scared.
I know, but it'll be okay, I promise. 5 days later, and my life has taken a rapid turn for the worse. I brought Walter into the clinic to see the doctor and spent time hating myself. Why hadn't I gotten Walter vaccinated before? As a nurse, I should have known how important it is. The vaccine is kind of new, but I have access to it. It's safe and effective. And now that Walter has likely been infected, it's too late for that. Walter experiences jaw stiffness and spasms in his back. It's horrifying to watch. Whenever he seizes up, it's as if he turns into a statue, stuck to whatever position is decided for him. The doctor confirmed that Walter has tetanus, and that he only has a week or so to live. Over these past few days, I've noticed his spasms getting worse. His back arches and extends, his arms fold and stretch backwards, and I hear his pain cries, which I am powerless against. I can't help but weep for my son at this point. Have I failed as a mother? If I only had been more careful, maybe he wouldn't be struggling with this right now.
I love you.
Maybe I wouldn't lose my son. Well, that's really sad.
I agree. However, luckily, tetanus is now preventable and treatable. So once a person has contracted tetanus, you can treat their symptoms with things like antibiotics. And at the time period, there was a vaccine, but Walter unfortunately never got it. Now we have a new vaccine called the Tdap and the DTaP, which are super effective, super safe, and extremely accessible to everyone.
That's really good to know. Do you guys have any other diseases you're hosting in your exhibit?
Actually, we'll be hosting a lot of new diseases from the Jazz Age. My favorite to talk about are typhoid and encephalitis lethargica.
Oh, encephalitis lethargica, I know that one. One of my relatives actually had it. It was that short epidemic during the 1920s where patients had the compulsion to sleep.
Yeah, and as you probably know, it sadly was not treatable.
It's not?
Yeah, you couldn't really ever actually get rid of the disease, even though you could treat some of its symptoms.
That's truly unfortunate. But, well, since I knew you guys were coming here today, I brought one of the journal entries from the relative that had that. Do you guys want to see it?
Of course.
Let me get it out. Right here. Hey, Doc, it's been a while, I realize. I don't live in my house anymore. I'm stuck in a hospital. The new doc here won't tell me anything about what's wrong with me. I don't get why he's treating it like a big puzzle. It's frustrating, especially when he calls me Sleeping Beauty. This new room is the complete opposite of my swanky house, all bleak and boring. The white paint is patchy and the floor creaks. It's awful. A ghastly fume moves over my bed, and it makes me want to walk and get fresh air. Every move I make pulsates with pain. I fear that my stocks will worsen. They come up with something for diabetes, but no stinking treatment for whatever I have. If only my dad got the insulin before he passed. But unlike him, I got people to live for. Every passing day, I lash out more. Just today, I had bleeding red slashes across my wrist. And get this, they're saying I did this to myself. Bushwa, I tell you. Well, whatever I have, it definitely isn't good. Look, I'll just send you a check for all your services the past 6 months before I run out of money. See you, Doc.
Yeah, it seems like his chances of survival were quite small, so I understand why his tone was so good. However, that's a very valuable document. Do you think we could feature that in our exhibit?
Yeah, of course, it'd be an honor. Here.
Thank you so much.
Yeah. And what was that other disease that you mentioned? Typhoid? What's this I hear about Typhoid Mary?
Well, as you can see from the graph above, there was a significant outbreak of typhoid during the Jazz Age. So, typhoid is spread through body contact and contaminated food and water. And during the Jazz Age, there was a lot of close contact between people, and due to the downgrading economy, clean food and water were hard to come by. And the special thing about Typhoid Mary is that she was a symptomatic carrier. As you can see here, we have a soap note from Dorothy Adler, who talks about her symptoms of typhoid, which is lethargy, delirium, rose spots, abdominal pain, and high fever. These are all typical signs and symptoms of a typhoid patient, but Mary, like I said, being a symptomatic carrier, showed none of these signs and symptoms, but she still carried the bacteria. Appearing healthy helped her continue her job as a cook, which is how she spread typhoid to several families. Now, as we previously saw in the graph, there was a dramatic decrease of typhoid as decades went on, and that's because, due to the Typhoid Mary outbreak, vaccines for typhoid became accessible to the public and treatments were found for typhoid.
Wow, that's really great. So, what can we learn from Typhoid Mary, people? 1, stay vigilant. 2, stay sanitary. It'd be a shame if you actually got typhoid. And with that, here's a live word from one of our sponsors. Doctors, if your patient has diabetes, they can say goodbye to starvation and hello to insulin. It has been in the works and has finally come to us all thanks to Banting and Best. Since then, we at Novo Nordisk Pharmaceuticals have developed insulin to lower sugar levels in diabetes sufferers. For only $3, you can get insulin encased in a 20-milligram vial. This needs to be administered through a syringe, so talk to your doctor today. Insulin may cause headaches, tremors, rapid breathing, and rapid heartbeat, and even worse cases, death. Buy yours now. And welcome back. I think we're about closing up here. Do you guys have anything else to say?
Well, I would just like to say thank you to everyone here and the wonderful host for having us here today. And also, I would like to remind you all to visit the Doja Libby Medical Museum, which will be opening the new jazz exhibit on April 12, 2018.
Yes, I would just like to express a huge thank you to our wonderful audience and, of course, our lovely host, Caitlin Pambid.
Yes, thank you all, and I remind you to wash your hands. I know common sense isn't a flower that grows in everyone's garden, so this is just a friendly reminder.
Yeah, stay safe, people, and I'll see you next week on the Daily Ed.
Bye, guys.
Matt, you're going to send me a copy of the
I totally did all the good.
Or Matt.
Oh, just barely? Nice.